I am Shannon Coombs, a first generation Jamaican American medical student from Elmsford, New York. The thing that inspired me to pursue medicine was seeing my mom, who is a nurse, and seeing her work in healthcare. But for me, it was a positive and a negative inspiration. I saw my mom working and heard a lot of her stories dealing with patients, and I thought, oh, medicine is an option. But it never really came onto my radar until after I spent a summer in Omaha, Nebraska, and I did a program called Summer Medical Dental Education Program. There I met people from all different backgrounds, and I was kind of thinking maybe something medicine related, maybe something law related, not really sure, until I had a conversation with another program participant who he wanted to be a physician.
Yeah.
And just hearing some of his thoughts and perspectives, specifically about people of color, was very disturbing to me. And it made me think a lot about family members like my mother who, struggles with her health, even as a health professional. A lot of times she doesn't really take good care of herself, exercise and, managing like hypertension, diabetes, all of these like comorbidities that factor into negative health outcomes. And thinking
Yeah.
about my family members who are incarcerated. And for me, the disturbing part was imagining someone like that taking care of my family members and coming at them with all of these preconceived notions of what it means to be a person of color and not coming from a perspective of being empathetic and understanding that just because someone comes into your office as a patient and doesn't do all the perfect things, that doesn't make them a bad person. And going beyond the surface level of things, really look at what are some of the things that are factoring in that person's health that you might not see as a healthcare provider. And I became very angered by that and also inspired by that. I want to be the healthcare practitioner who is going to actually care and listen to people. And from there, just getting more exposure to what being a medical professional is through shadowing, I just became like really inspired by the people who I saw working in the community, and I wanted to do the same thing. So it has felt isolating. Just sometimes I always feel like I don't have the playbook for how things are supposed to be. But in my medical school, I'm lucky enough to have friends, specifically other women of color who come from other immigrant backgrounds. I have had community of other, women who were interested in education, but not always women who are specifically interested in medicine. So for me, having that group of women has felt amazing. And it's also taught me how to be a better friend, to be a better person. My classmates and the community of women around me are some of the kindest, most compassionate, loving people I've ever met. I have never been a part of a friend group of people whose interest and whose care for the community so perfectly mirrors mine in medical school. I believe that it's important in healthcare to have diverse representation because you need people from different backgrounds to give differing perspectives. And I saw this when I was in that program, but I also see it in medical school, that it's important to have a diverse class because other people's experiences can illuminate and teach you more about the world and teach you more about your future patients. The thing that pushes me to keep going is my family. Being home has been such a breath of fresh air, and it's reminded me seeing how hard my parents work and how hard, my siblings work and seeing my little nephew. It inspires me that I have people around me and all my mentors who believe in me and they trust that, they have put so much work into guiding me. And for me, I work hard for them and I study for them, and being on this career path, you know, even when I'm tired and I don't want to study, or even with my fear about third year, I think about my family, my parents who immigrated to this country and how far they've come, and all of my ancestors before them. And it's like, I'm not an imposter. I'm where I'm supposed to be. And if they have worked so hard and gone through so much, they've put all of those same ingredients into me as a person to get to this point and to get beyond this point and to be successful. And if I let, you know, feelings of inadequacy stop me, that is doing a disservice to them and to all of the people around me.